Bruised heels, and how do we treat these with orthotics? So when we're treating a bruised heel, the most important thing to figure out, funnily enough, is did you actually bruise your heel? Can you remember bruising your heel? Did you jump down from something and stand on something and cause an injury to your heel? This would obviously then be a bruised heel. If you don't recall actually standing on anything or bruising your heel, then it's most likely you've got something like plantar fasciitis or the insertional plantar fasciitis, where it attaches into the heel and it pulls away from the heel bone. So first things first, to treat a bruised heel, if you've jumped down, stood on a rock and bruised your heel, what we usually do is ice this, use Nurofen, and then we put a soft cushioned insole under your foot, something like this. This is the Ergonx Ultra Soft. And the aim of this is to cushion the heel, so we've got this nice pour-on cushioning position in the back of the heel, and you can see it's really quite nice and soft. And so what the aim of this is to do is to take some of the weight of in the arch here, so it removes some of the weight off the heel, so you don't aggravate the bruised section. It's also got this deep heel cup, if you can see here in the camera, deep heel cup that keeps the foot's natural fatty pad underneath the heel, so then you won't put as much pressure on the heel, on the bruised section, and then this helps to heal over time. So if you've got a bruised heel, cushioning, icing, Nurofen, this will help to improve your recovery time. However, a more common problem that people present to the clinic with is what they think is a bruised heel, but it's actually plantar fasciitis. So with plantar fasciitis, if we imagine we've got so we'll go back to the trusty old foot skeleton here. The plantar fascia is a ligament that runs down the length of the arch like this. So what actually happens is where this plantar fascia attaches into the heel, which is right under the weight-bearing section here on that medial calcaneal tubercle, you can actually see this little lump sticks out right here. What happens is when the arch collapses, this ligament gets pulled away from the bone there, and it causes a little bit of bleeding where the Sharpie's fibers pull away from the bone, or the periosteum pulls away from the bone. And what happens is you get a thing that feels exactly like a bruised heel, but you can't remember bruising your heel. So what we actually do to treat this is we need to look at anything that causes tension in that plantar fascia. And so just to outline where we'll get there, we'll get the pain right here under the heel. So it's in a very similar spot to if we jump down and bruise our heel, but we can't remember actually bruising the heel. So treatment for plantar fasciitis, we've covered in another video, but treatment is aimed at stopping the foot from rolling in, so that will strain the plantar fascia. We support the arches with a soft full-length orthotic innersole like the Ultra Soft here. This helps to keep the arch height high, so there's less strain on the plantar fascia. We stretch and strengthen the calf muscles. We wear a good supportive work shoe or running shoe, so we want to make sure that our work shoes and work boots don't let our feet roll in, because that strains the plantar fascia. Also, if we've got tight calf muscles, that makes the feet roll in further and harder and faster, which strains the plantar fascia. And if we're wearing worn out shoes, or shoes that don't support our feet or don't cushion our heel enough, that can also make the foot pronate faster and further, and that strains the plantar fascia, so it'll make the plantar fasciitis worse over time. So they're the two things we need to look out for when we're dealing with a bruised heel. Is it actually a bruised heel, or is it plantar fasciitis? And the treatments are very similar but slightly different for plantar fasciitis. I hope this helps. Thanks. If you enjoyed this video, please like, comment and subscribe. It's really simple to do, and it really does help out our channel. If you need more information on the topics discussed, you can find some links in the description where they'll take you to our website, where we can discuss this in a little more detail. If you have a specific question that you'd like answered, please comment in the comment section below, and we'll do our best to make a video to address your question. Thank you all for watching, and we'll see you next time.